All right, here we go. 8:15 and a half, first day of October. It's Thursday, highs of 83 today, and the weekend's going to be spectacular. So make some plans to get out and enjoy that, if you will. It's our favorite time of week because we get to talk to Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health, about senior health. And today we're going to focus on women's health. Breast cancer and osteoporosis are two diseases that primarily affect women, but not exclusively. Dr. Brent Wallis from People's Health joins us now to discuss both diseases and the steps women can take to protect their health. Good morning, Dr. B. How are you?
Hey, Tommy. I'm doing great. How about you?
I am okay, and it's good to talk to you again. How common is breast cancer?
It is very common. In fact, it's the second most common type of cancer for women, and the risk of it actually increases with age. So what's really important about breast cancer is early detection, because if you catch it early, then you can actually save someone's life. And the way that we try to do that is through regular screenings, in order to identify the disease and then get people into treatment so that they have a better chance for a full recovery.
Have you noticed professionally that maybe sometimes people fall victim to they don't want to know, that kind of like the head in the sand kind of thing, and that prevents them from getting the screenings or holds them back from getting the screenings they really should have?
Yeah, I think people, innately are kind of scared of what they may find out. But with breast cancer and a whole lot of other diseases, it's much better to know early so that we can address it and do something about it. So definitely don't keep your head in the sand.
It is what it is. It's not going to change just because you don't know about it. What steps can you take to detect breast cancer?
There's a couple of things you can do. One of the most important is make sure you see your primary care physician annually, or for women, that could include also an OBGYN. And your doctor a lot of times will perform a clinical breast exam to see if they identify any lumps or anything abnormal in your breast that needs to be checked out. The other thing that's real important for women to do is self-exams. So everyone's breasts are different, and some things can be very normal, so knowing that something has changed is very important. So that's why it's real important for you to do that as well. And then obviously mammograms are important. We're going to be talking a lot about that this month because it's October. But all women between the ages of 50 and 74 should get a screening mammogram once every 2 years, sometimes more often depending on what's found on the mammogram. And if you're younger than 50 or older than 74, you should talk to your doctor, because certain risk factors such as family history or personal history of breast or other types of cancer may make them want to screen you either a little earlier or a little more frequently.
Is that necessarily an expensive procedure, doctor, or are there coverages for that?
Yeah, it's covered. Under People's Health, there's no copay associated with mammograms, and for most health insurance plans, all preventative screenings are covered.
One of the best friends I have in the world is a breast cancer survivor, and thank God she had it checked when she did and fought the tough fight and got through chemotherapy and now is living a happy life. What advice would you have for somebody preparing for a mammogram?
Yeah, so no one likes mammograms. That's definite, but it's sort of a necessary thing to identify the disease, like we talked about. So a couple of things you can do to make it a little bit easier on you is cut back a week before, because the caffeine can actually cause some changes in the breast that can be found on mammogram. Another thing that a lot of people don't realize is don't use deodorant or antiperspirants under your arms or on your breast before the mammogram. Deodorants can contain aluminum in them and some other chemicals that can actually show up on the mammogram, so that can cause unnecessary concern. The other thing is, women are going to have to take off their top, so they need to make sure they wear a two-piece outfit. And if your breasts are real sensitive, just let the technician know, because they can definitely be more gentle and take a little bit more time doing it, especially if you've had an uncomfortable mammogram in the past. Let them know about that. You can also take an over-the-counter ibuprofen or Tylenol. Sometimes that can help relieve the pain a little bit. What you don't want to do is be scared of getting the mammogram and then you don't get it done. So if you take those steps, hopefully you can get it done effectively.
All right, we take a break. We'll talk about some lifestyle changes to hopefully prevent breast cancer. We'll also talk about osteoporosis when we come back. Dr. Brent Wallis, Chief Medical Officer of People's Health. Every Thursday at this time, we talk about senior health to help you out if you are a senior or the son or daughter with a senior parent. 8:21 now, time for traffic on WWL. 8:24, Tommy Tucker, WWL, October 1st, and October is Breast Cancer Awareness Month, and that's what we're talking about with Dr. B. Dr. Brent Wallis, Chief Medical Officer of People's Health. Doc, are there any lifestyle changes that people can make to maybe help prevent breast cancer?
Yeah, definitely. Like most medical conditions, exercise helps tremendously. In fact, regular aerobic exercise can cut your risk of breast cancer in half. And being fit also can be very important if you're diagnosed with breast cancer and need treatment. And then, of course, diet plays a big role in prevention of a lot of diseases. So green leafy vegetables, fruits, and grains can be very helpful. You should definitely limit your alcohol intake and completely avoid tobacco because those can also increase your risk as well.
What about hormone therapy?
Yeah, we don't use hormone therapy as often for menopause symptoms now, but if you do happen to be on it, you should talk to your doctor about whether or not you should continue it or perhaps go on a lower dose of those types of medications.
It's amazing how the body apparently was not meant to be sedentary, was it?
No, definitely not.
Let's talk about osteoporosis. What exactly is it?
So osteoporosis is basically bone weakness. So, throughout your life, your bones are living, and so they lose cells and regenerate cells. And as you get older, the regeneration process slows down a little bit. So what happens is your bones can actually become thinner or more brittle, so you're more at risk for a fracture if you fall down.
Does osteoporosis only affect women?
It doesn't only affect women. We definitely have men with osteoporosis as well. It's more common in women, and it has to do with the hormones after menopause.
So what are some of the risk factors for osteoporosis?
Definitely family disease. It runs in families, and then increasing age as you get older, it becomes more common. And race can play a factor as well. Actually, Caucasians and Asian adults are at the highest risk. African Americans and Hispanics are at a lower risk, but still can have significant disease as well.
Other risk factors, I guess the same old thing, smoking, alcohol, etc.?
Yeah, definitely. Just like breast cancer, smoking is never good. Heavy alcohol use as well. And then actually a low calcium diet. Your bones need calcium to grow. Inactivity is real important too, like we were talking about with the exercise. If you exercise your bones, weight-bearing exercises can actually help to grow stronger bones. So that's why we tend to see osteoporosis a little more in people who are very low weight. So as you get older, some people actually lose a lot of weight, and that can lead to a higher incidence as well.
Medication?
Yeah, the medications that most affect osteoporosis or can lead to it is use of steroid medications. And we use steroids for a lot of conditions. It's not as much of a concern if you're on a real short course, but if you're on chronic steroids that you take every day, that's a huge risk factor for osteoporosis.
A text comes in and says, how do you know if you have it?
Yeah, really the only way you know is two things. Either you get screened for it or you fall down and have a fracture. And unfortunately, most often it's the latter. People actually fall down, they end up with a hip fracture, and then when they're tested, they find out that they do have these brittle bones. But it's real important to get screened for osteoporosis as well so that you can prevent it.
Some lifestyle tips to help prevent that kind of thing?
Yeah, very similar to what we were talking about before. Food plays a big role. High calcium foods are very helpful, and vitamin D in addition. So things like milk, yogurt, fish, and leafy green vegetables. And then, like I mentioned, at least 30 minutes of physical activity a day. That helps your bones grow stronger. So that's real important. Avoiding smoke, even secondhand smoke, can have some bad effects on you, so you should avoid that. And then limit your alcohol intake. Your doctor may actually tell you to take some supplements as well, like a calcium supplement or even a calcium with vitamin D supplement, because that can help to slow the rate of the bone loss.
Very informative, Doc. When it comes to exercise, you don't have to train for the Olympics, do you?
No, definitely not. It's really not leading a sedentary lifestyle and making sure that you're active. So walking, riding a bike, all of those things can actually be very beneficial for osteoporosis, but really for your health in general.
Thank you, Doctor. I appreciate your time. Hope you have a great weekend. I don't know if you heard Betsy, the boxer, in the background. She was trying to tell you hello.
Tell her I said hi. Have a great weekend, Tommy.
You too, sir. Thank you, Dr. B. Dr. Brent Wallis, Chief Medical Officer of People's Health. You can always go to peopleshealth.com. You can call 1-855-821-2666 to find out more about People's Health, and you can follow them on Facebook, Twitter, and